comedian?
Hey, I am good. It's been an amazing week, and I survived it because I have my pellets from you, so that helps me to stay in the groove. So
Good.
today we're gonna be talking about ovarian cancer, and it's a whole lot of information out there, and some things that hopefully we can share with some people about it. Because of course, you hear that C word; it's scary, and there are so many types of cancer. So let's talk about ovarian cancer. What are some of the signs that we know that we may have this?
So that's the tricky thing about ovarian cancer. But first, let me say, for those of you who don't know, I'm Dr. Mia at Me Bella Wellness Center, where we offer gynecology to women and adolescents, as well as weight management, hormone pellet therapy, intimacy services, total wellness with supplements, and laser hair removal for both men and women. Our goal is to help you live well, age well, and experience everlasting intimacy. And thank you, Comedian Joy. We are talking about ovarian cancer. Because it is Ovarian Cancer Awareness Month. So we thought that we should definitely highlight this disease that does affect quite a few people. So you asked about the signs and symptoms, and that's the tricky part about ovarian cancer, because most people don't have signs or symptoms necessarily until it's the end stages. So things that would put you at higher risk for ovarian cancer is age. Again, it's still the second most common gynecologic cancer. For women in the United States and around the world, and it does have a higher death rate when compared to the first most common gynecologic cancer, which is endometrial cancer. The good news is that in the past, it almost felt like a death sentence if women were told that they had ovarian cancer. Now there are some great treatment options out there, and women can live for a long time after ovarian cancer. So signs and symptoms are very non-specific. So that's the problem. It may be nausea. It may be a woman noticing that her belly is getting bigger. Some people have the luxury of having pain from the ovarian cancer. So that allows them to come to the gynecologist, get an exam, actually get an ultrasound. If I see a tumor, so, ovarian cysts come and go. So that's the thing. Ovarian cysts come and go. So a woman, most ovarian cysts are not cancer. But women in their 40s to 50s are more likely to get ovarian cancer compared to women in their 20s and 30s. The most common kind of ovarian cancer, which is about 95% of ovarian cancers, that's an epithelial ovarian cancer. So that's the most common.
And what's the name of that again?
Epithelial carcinoma of the ovary. So it's like certain types of ovarian cancer, but the most common is the epithelial carcinoma of the ovary. So the reason we can't really screen for it is because we don't have that high risk population that we can easily just say, okay, you're high risk, so you need to be screened for ovarian cancer. Now, we can say you're high risk if you have a strong family history of breast, ovarian, or uterine cancer. And then you can also put in there colon cancer and sometimes pancreatic cancer, depending on which genetic mutation it could be associated with. But outside of that, usually it comes from a cyst on the ovary. That cyst continues to grow. It turns into cancer, and women don't have a lot of symptoms. Sometimes it may be a little bit of nausea. Sometimes it may be a little bit of fatigue. Usually by the time the real symptoms start, like the pelvic pain or the bloating of the belly and the abdomen, sometimes it can be something like rectal bleeding. Sometimes it can be something like severe constipation. But the symptoms, as you can hear, are so non-specific. Also, shortness of breath sometimes can be because of ovarian cancer, because as it progresses, it can cause ascites, and it can cause ascites, meaning fluid in the belly, and your belly kind of gets bigger sometimes and it's smaller sometimes. And then pleural effusions, also meaning around the lungs, you can get some inflammation that can cause shortness of breath. Again, sometimes pain, sometimes pressure, sometimes urinary urgency or frequency, the abdominal distension. A lot of people with ovarian cancer will notice that they can't eat as much. So they get nauseous when they eat. They don't want to eat. They start eating less. A lot of times they lose weight and they get full really, really, really fast. So those are some of the signs and symptoms. But, like I said, nausea, vomiting, increased size in your belly, especially at the very beginning, there aren't severe symptoms to know to even look for it. So that is why it is so important for women to get their regular exams.
So let's talk about the exam, because at that age, 40s and 50s, sometimes ladies are going through menopause. Then you have the other group, my group, where you don't have a house or you've had a hysterectomy. So at some point I was told I don't need to come back to the doctor because I have ovaries, but I don't have a uterus. So what is the deal? Do I, don't I? When you stop? Yes.
And thank you for bringing that up, because that is misinformation. Just because you have a hysterectomy doesn't mean you don't need a gynecological exam. Now, you may not need what we call a pap smear, and that's what I always try to differentiate for women. Women, when they think of a well woman exam, that most women under the age of 65 should be getting every year, starting between the ages of 13 and 15. A well woman exam is simply a prevention and screening exam. During that exam, we do a breast exam, a manual breast exam, except for those, especially for those women who are over 21. We do a pap smear if a woman does have a cervix and she's over 21. We also, if they don't have a cervix or a uterus, we still need to look at the outside of the vagina, the vulva. We also want to look at the inside, the vagina. We also want to feel and make sure that even if you've had your uterus removed, we may not have removed the ovary. So we want to do that, what we call bimanual exam, where we actually insert 2 fingers and we push down on the belly, and that'll let us know if your ovaries are abnormal. So it is still very important for you to go to the doctor and have your exam at least every other year if you've had a hysterectomy. If you have had a hysterectomy and you're under 65 and you still have your ovaries, you should be getting your exam every single year. If you are under 65 and you still have a uterus, you should be getting your exams every year. Women continue to get pap smears from the age of 21 to 65 every year, or every 1 to 3 years, depending on their history and depending on their history of pap smears. But again, just because you've had your uterus removed does not mean you don't need to see the gynecologist. You should still be getting your regular well woman exam. You just may not need the actual pap smear. We're looking for cervical cancer because your cervix was removed and you don't have a history of problems with your pap smear. So those are the women that may not need the pap, but you still need the rest of the exam. The pap is a very small part of a well woman's exam. The well woman's exam, again, breast. We know we check your belly, we check your uterus, we check your cervix, we check your ovaries, we check your fallopian tubes. Another important thing that's related to ovarian cancer is now when women want to have a tubal ligation so that they don't get pregnant anymore, and they don't necessarily want to do it with hormonal birth control or a non-hormonal IUD, we remove the tubes now. And we started removing the tubes because studies have shown that removing the fallopian tubes instead of just burning them actually decreases the risk of ovarian cancer. So now when my ladies come in and, they have not done anything for sterility, meaning they are still, able to get pregnant and they don't want to for whatever reason, instead of just burning the tubes like we used to, now we just remove the tubes because that does decrease the risk of ovarian cancer.
So if they get the tubes removed, then I guess then they too still need to have the yearly well woman visit.
They do, because there's a lot of times when we just remove the tubes, you still had an ovary. So we still want to examine those ovaries on a regular basis.
And then you said up to 65. So when I turn 66, then what I do?
Every year. After 65 is every 2 years.
Okay.
So up to the age of 65, you should be seeing your gynecologist or your family practice doctor for a well woman exam every year. Once you're 65, you can go every 2 years having your well woman exam.
I guess it's drying up by then, huh?
If you have a good gynecologist, they've already taught you to treat your vaginal tissue to make sure that things are not drying up. So no, you should not have dry vajayjay if you are doing your preventive strategies by topically treating the vaginal tissue on a regular basis starting at the age of 40.
So let's talk about the fact. So I do want to share a personal story. So my mother had she had a hysterectomy shortly, I guess like a year or so after I was born. And so she was diagnosed with ovarian cancer. So this has been over 10 years ago. But when I heard the C word, obviously it was scary. And I didn't think to say, well, she doesn't have ovaries and you don't really argue with the doctor. My mindset was to get that second opinion. But you're saying that there are different types of, I guess, ovarian cancers that you can get, even if you don't have an ovary.
Right. And we kind of lump three together: the ovarian cancer, fallopian tube cancer, and then there's this thing called primary peritoneal cancer. So for some women who may have had a complete hysterectomy where the uterus, the cervix, the tubes, and the ovaries were removed, there is this thing called primary peritoneal cancer that looks like ovarian cancer, acts like ovarian cancer, but they didn't have the ovaries where the ovarian cancer actually started. But they can still have all of the seeding and all of the adhesions and the caking of the omentum, the bloating, the ascites, and all of the other things that go along with ovarian cancer. It just didn't start in actual ovaries, because many times those women already had their ovaries removed. So that's why it's important that even though you've had everything removed, you still need to go get an exam, and you still need to acknowledge changes in your body. Like if you're starting to all of a sudden have significant nausea, you're starting to all of a sudden have significant shortness of breath, you can't eat as much, you're losing weight, you're noticing that you get the abdominal distension, the bloating that's going and coming. And a lot of times there will be some discomfort and some pain associated with it. Sometimes with fallopian tube cancers and some of these cancers, there will be an abnormal discharge. Now, 99% of the time when you have abnormal vaginal discharge, you don't have a cancer. However, sometimes those women will notice a new watery kind of funny discharge, and we test it and we know that it's not anything like bacteria or yeast. Well, then those people are going to still need to get that ultrasound and get some more imaging to confirm that it's nothing else going on inside. And usually that's going to be associated with other symptoms like the bloating and the shortness of breath and the constipation, and the getting full faster, like so early satiety and the distension and those sorts of things. But that's the weird thing about ovarian cancer, is initially when it first starts, a lot of women don't have any symptoms. It's not until it's in the latter stages of the disease that women start to notice the symptoms. But the good news is that compared to 20 years ago, when a woman was diagnosed with ovarian cancer, her survival rate was very low. And we have improved those survival rates over time with new treatments, new chemotherapies versus radiation therapy versus surgeries. So the survival rate has improved some, but it is a very difficult cancer to predict earlier or detect early, which is the reason why it has such a high death rate.
Right. And so she did have the nausea and the shortness of breath. And so eventually they found it when she was getting the gallbladder removed.
Oh.
Right. And by then you just kind of start to do the normal process. And then of course with chemo, that sets off another whole set of things. And I knew you back then, but life be life.
Right.
You're just trying to do what you can do, but it is great to know this information ahead of time, because of course our bodies change, and with symptoms like that, old school, hey, drink some Buffalo Rock. Your stomach hurt. Don't eat no greasy food. We try to do the obvious things, whereas you're saying that we need to continue to dig deeper and think about things like that with our health.
Right. So yeah, if you're starting to have nausea all of a sudden and you can't eat as much as you used to, don't just write it off and get excited about it. Figure out exactly what's going on. See your primary care doctor, and then you have to advocate for yourself in healthcare now. If you are concerned about something, I've had plenty of patients who had concerns, and it would be something simple. Like, for example, I had one patient who had a cough, and it was just a cough that didn't go away. She saw a bunch of doctors and they were just like, it's just a cough. Don't worry about it. Where she pressed on and advocated for herself, and she made them do the CT scans, and she ended up with a renal cancer. It was a renal cancer that was causing something as weird as a cough that wouldn't go away. But because she was persistent and she really advocated for herself, she got a diagnosis early with a great prognosis. And it was only because she made them continue to figure out what was going on, and she demanded that they do imaging so that she could figure it out as well.
But who would have thought? Renal, that's kidneys though, right?
Right. Like, who would think that nausea is ovarian cancer? Who would think that funny discharge is fallopian tube cancer? So I think the thing that everybody needs to take away with them is some things are out of our control, but we have to pay attention to ourselves. We have to pay attention to our body. We have to pay attention to changes. And if we can't figure out why something is happening, we need to make sure we find a doctor who will help us figure that out and get the right and proper workup. And don't let anybody downplay your concerns.
Right. And stay off medical MD because he didn't go to school for us. That's why we have people like you and professionals. And then you also work with the team of other professionals in case it's something else outside of your gynecological scope that you could
That's
obviously
right.
give us referrals to.
That's right. And that's what I do. I refer, if I can't figure it out and there's something going on, I send them to a specialist, and we have specific doctors. So that's the other thing, is when somebody has an ovarian cancer, which is why if a woman comes to me in her 40s or 50s and she has an ovarian cyst and it's a complex cyst, it's, over 3 to 4 centimeters, I recheck the ultrasound, it doesn't go away, I'm going to get tumor markers. And the tumor marker that we look for is a CA125. CA125 being highly elevated concerns us about ovarian cancer. People who have a low CA125, we're like, okay, well, you don't have ovarian cancer. But people who have a high CA125, it can mean nothing or it could mean ovarian cancer. So that's why if a woman in her 40s, 50s, especially 60s, 70s, 80s, they have a new ovarian cyst, we are a lot more aggressive with figuring out what's going on with that cyst. We get tumor markers, and if we feel like they need surgery, we send them to a gynecology oncologist, which is somebody who went through an OBGYN residency for 4 years, just like me, but then they went for additional training in GYN oncology. And that's where that's where I send my patients who have a GYN cancer, like ovarian cancer or uterine cancer. Sometimes if they just have severe endometriosis or a lot of scar tissue from previous surgeries, we would send them to a GYN oncologist because they're more skilled surgeons compared to just a general OBGYN.
So let me ask you this. So for women who may have to get a hysterectomy or they choose to, should they also take the tubes? Like,
yes, so we always take the tubes. So if a woman's getting a hysterectomy, we remove the tubes. We don't necessarily remove the ovaries, and there's no reason to remove the ovaries because of the slight chance of ovarian cancer, unless somebody has a significant family history of breast, ovarian, uterine cancer, or they know that they have a known genetic mutation that increases the risk of ovarian cancer. Somebody also who has a genetic mutation that doesn't include ovarian cancer, but is breast cancer, that would be a reason to take the ovaries out too, to decrease the risk of ovarian cancer by decreasing the hormonal, the hormones from the ovaries. So those are reasons to take them out. If somebody's over 60 and they have something going on, or they're over 55 or 60 and they have something going on with their ovary, I'll go ahead and remove that ovary. However, if somebody is 45, 50, and they don't have any real risk factors, we say leave the ovaries, because leaving the ovaries does protect the heart. And even if somebody is perimenopausal and they're starting to notice changes, removing the ovaries puts them in a surgical menopause. So for benign disease and without real risk, it's not necessary to remove the ovaries just because you're having surgery.
Gotcha. So technically, all of our parts and pieces are there for a reason, and God knows why He made us the way He did. Because of course, for some women, because of course I see things on social media, when you have the fibroids, the excessive bleeding gets to be too much, and so first thing we want to say, hey, take it out. I'm done having kids. Take the whole kitchen, the back seat.
Right. They like, I don't ever want to have surgery. I'm like, no, that's not what we want to do, because the number one cause of death in America is heart disease. So removing the ovaries early ages your heart, because now you don't have the estrogen, the progesterone, and the testosterone protecting your heart anymore. It's normal for that to go away in the 50s, but for somebody who had a hysterectomy in their 30s, getting your ovaries removed that early, which some women need it. Some women have severe endometriosis and they have so much pain and so much scar tissue that they need their ovaries removed. So what I say about those women who actually needed their ovaries removed, they don't have any kind of cancer or anything, doing the hormone replacement therapy will definitely help protect the heart, the bones, the breast, and the brain, and that will make up for them having their ovaries removed early. They'll still have access to hormones that can help improve their quality of life as well as their health.
But the natural thing would be to try to leave them as long as possible, and then still get the treatments if you needed to help along the way also.
That's right. But yeah, hormones can be balanced regardless. We know that hormonal balance definitely improves the quality of life. And it also improves your health. Everybody can't have estrogen and progesterone. Because especially if they've had a GYN cancer or breast cancer, ovarian cancer, endometrial cancer. However, testosterone is not contraindicated in any woman. Any woman can take plant-based bioidentical testosterone therapies, which is the pellet form, my favorite, and there's also a cream option as well. But that is anybody can use it, and that's going to help with sleep and sex drive and orgasms and night sweats and energy and memory and focus and mood and joint pain and belly fat, which those are, most of the symptoms that bother people the most are actually from low testosterone. So even though you may not be able to do the estrogen and progesterone, there's still an option to feel better, age better, and live better with testosterone replacement.
Wow, this is, again, every time we do these sessions, it's just so informative. It's so many parts and pieces that we need to think about. And basically, in a nutshell, to continue to see your doctor, because even with my primary care physician, he loves to schedule those 6 months. In my mind, because I grew up in the country, old school, I only need to see a doctor if I'm sick. But you, along with the other healthcare professionals, are saying it's preventive maintenance. So if you see it early, if there's something wrong, you can catch it, fix it, and keep it moving.
That's right. So prevention and screening is everything. So ladies, even if you've had a hysterectomy, you still need to see your gynecologist or family practice doctor so you can have regular exams. Even though we may not need to do the pap smear for cervical cancer screening, we still need to check your breast, check your abdomen, look at the outside, look at the inside, and make sure that you continue to have great sexual function and health in general, because a lot of times the gynecologist is the only doctor a lot of women see, even though I recommend they see a primary care doctor. But since I'm that person that they see, I make sure that make sure that they have done everything they need to do for prevention in all areas of their health, not just gynecology.
And you also make sure that they get the mammograms, which is important.
Yes, so screenings should be the mammogram starting at the age of 35 for a baseline. I still recommend that. I don't care what the literature says, because I found enough women to have a problem that I was glad I made them do that early ultrasound. That early mammogram. But starting at 40 every single year, they say starting at 65 that you can do it every 2 years. I still recommend getting it every year, because early detection is key for survival with breast cancer. Colonoscopies prevent colon cancer. So having your regular colonoscopy starting at the age of 45 is going to be key, or 5 years before your first or second degree relative was diagnosed with colon cancer. And then we want to make sure that you are getting your blood pressure checked and making sure your blood sugar and your hemoglobin A1C is good, getting your cholesterol checked, getting your blood sugars checked. So screening and doing all of those things that we can do to prevent and for early detection, that's what's going to make the difference in how you age and your health and wellness, and as you continue to mature and go through this journey of life.
And some of the things that can determine those numbers is what you eat. I encourage people to eat the chicken, clean your bones, but you don't have, even though I'm a lover of fried chicken, you don't have to eat it fried in grease all the time, but you should.
At those air fryers.
Exactly. I even air fry my salmon because I'm just a lazy cooker. I've been trying to transition to a lot more seafood. So once I leave the gym, so I can get my workout in, I put my salmon in the air fryer, go take a shower. When I get out, I toss it over a salad. Voila, I have a healthy meal. I eat the whole bag of salad because I'm like, it's just lettuce. Is that wrong, Dr. Mill, to eat that salad kit?
No, it's not. They may have some little extra preservatives, but we can't fix everything that's wrong with our food in America. All we can do is do the best we can to eat the healthiest food that we can afford to eat, and make good choices and watch our portions. And we know that processed food, a lot of sugar, and a lot of fried foods, we can avoid that, and we can decrease the salt in our diet. But we're just not going to have a perfect diet in the United States of America, but we can do the best we can with what we're working with.
Exactly. And you can clean those chicken bones, because I chicken shame people. But no. I digress. It's about the cancer, ovarian cancer.
Because being obese also increases the risk of all kinds of cancers. So again, going back to the basics, wellness, living a healthy lifestyle, maintaining a healthy weight, exercising regularly, getting your lean, healthy meats in, getting your fiber, your fruits and your vegetables, and your whole grains. All of those things are going to help you live a healthier lifestyle.
So let me hit on this real quick. Because you know how some of us are, we talk about the obesity does contribute to it. So what do we say? Child, these my grandma hips that was passed to my mama hips, and I just had these hips. Should we just let that be it's just in our family? You know, these bones are big, or should we be concerned with how much meat is on the bones?
Yes, I think weight matters and BMI matters. Less than 25 is what we say for normal weight. If it's 25 to 29.99, that's being overweight. And then once you're at that 30, you're obese, morbidly obese. And now they have a new definition. I think if it's over 50 now.
So
So,
is that the black folks chart or the white folks chart?
this is the chart. This is the chart for the people to show what's going to have an increased risk of death. So normal weight decreases your risk of death from a lot of chronic diseases. Being overweight is going to slightly increase it. And then the higher your weight is, the more risk that you have to deal with associated with cancers and heart disease and diabetes and high cholesterol and stroke. And, it's like very common now. Somebody said this, they were like, it used to be that in order to see somebody as large as 500 or 600 pounds, you had to actually go to the circus back in the 50s and 60s. But now it's commonplace to see people over 300 and 400 pounds. It's become almost a norm. And since we're seeing this big, huge increase in childhood obesity, if a child starts out with obesity when they become adults, usually that obesity just worsens. So yeah, it's important for us as parents too to make sure we're teaching our children healthy lifestyles. We're giving them healthy food. We're cooking at home so that they can have a healthy weight when they're young and they're more likely to grow up and be healthy adults.
Did you say regularly is we normally seeing people weighing 400 to 500 pounds? That's a norm?
Yeah, I mean, it's becoming very much more common. Like I have patients who have a BMI over 50 very commonly, and it's not just my older patients. I'm seeing that in my very young patients. So I've seen teenagers who have BMIs of over 50, and to me, eating can be a disorder, just like alcohol can be a disorder, just like drugs, like food can be an addiction. And a lot of times there's some kind of trauma or something associated with it. So again, focusing on that mental health as well, making sure if you have a history of trauma, you're going to your therapist and you're talking these things out so that you don't substitute your pain for food or alcohol or drugs.
Yeah, and so your whole lifestyle, it depends on those choices you make when you order the food. Because I had a crazy week this week, and I'm not gonna lie, I went to Waffle House. I needed the waffles with the pecans, and I had some grits and eggs. But I said tonight, since that job is over, I'm gonna eat my fish that's in there because I can't keep going eat no all-star platter because that's gonna mess up what I have been working real hard on trying to do.
And you went sick after you ate it?
No, I went to bed. I was tired. That felt good.
Oh, half of the reason that I'm healthier now is because so many foods upset my stomach. So they kind of make me sick. So I don't even have the option sometimes to eat crappy food because it's not worth how I'm going to feel afterwards. Exactly. So, mindful eating, paying attention how your foods make you feel. But like you said, you're going to sometimes have some of the things that you enjoy that may not be healthy. But as long as you keep it at like your 10 to 15%, and not your 80 to 90%, you can still be healthy and have some of the things that you enjoy.
Yeah, because I'm like, I can't keep making these options, but I do notice like certain foods makes me feel bloated. So I'm like, well, we're not going to do that. But when I eat my salmon, my salad, I feel great. I feel satisfied.
Yes. When I eat healthy, I really do feel better,
Mm-hmm.
So. Well, all right, y'all. I hope y'all learned something about ovarian cancer. I hope that you understand it is a significant gynecological malignancy. Ovarian cancer is the second most common. We don't have a lot of signs and symptoms at the early phase of the disease, like stage 1, stage 2. Usually symptoms come when it has progressed along. But the thing that you should get out of this is that ovarian cancer can happen whether you have ovaries or not. Ovarian cancer, fallopian tube cancer, and primary peritoneal cancer are all very similar, and they all need to be treated by a GYN oncologist, if at all possible, in your area. And where we are, we have access to several GYN oncologists, because again, ovarian cancer is a totally different surgery from benign ovarian pathology. They need actual staging by a specialist who has extra training and more advanced surgery, so that they can do lymph node dissections and staging of the disease, so that they know exactly the best way to treat them based on the research.
And one important thing some people may be wondering, so with these type of doctor's appointments, these are filed under your wellness. So typically it's covered with insurance, correct?
Right. So when you go for your annual, it is covered under insurance. You usually don't have to pay a copay if you're only going for screening. So if you go to your annual and you got abnormal discharge and you having problems with your fibroids and you got some abnormal bleeding, that is a different visit. So that's not going to be just your annual. Annual is when you go in with no problems. They do all your screenings, set all your screenings up, do your exam, and even birth control is included in your annual exam. But outside of that, it's not necessarily an annual, but you definitely should go to the doctor regardless of whether or not you have to pay a copay for the visit. Your health is your wealth, and you're worth the investment of your health. So if you're having problems, go to the doctor, tell them about your problems so that they can be fixed.
Well, I'm going to make my appointment to come and see you for my annual. Now that I know you need to be looking at the other side of me, you already see the back side. Now you're going to get to see the front. So I'm going to do that. So tell the other people who may not be a patient yet how they can reach out to you.
Okay. So you can go on my website, mebellawellness.com. You can actually schedule your appointments on the front page of the website, whether it's gynecology, where we do take insurance, and most insurance is for gynecology. And we also have some other services like the weight management and hormone pellet therapy, intimacy services, laser hair removal, and total wellness with supplements that insurance doesn't necessarily cover. However, some people can use their health savings account and their flex spending to cover some of those services. But we do take insurance for all of our gynecological treatment options, and some of the things you may have to pay out of pocket. But remember, you're worth it, because health is wealth and you're worth the investment. So
that's right.
Goal, yeah.
And when their results come back positive, they can come and join me on the Eat, Drink, and Ride food tour. They can have a great time. We will have something possibly healthy, but you can exercise getting on and off that bus 5 times, and then you can work out the next day after you eat that chicken, because we're celebrating your good results because you went to the doctor and you were checked out with Dr. Mia and me, Bella Wellness.
Yes, and y'all better make sure y'all follow Comedian Joy. First of all, she's a great comedian. She's clean, so you can even have her at the church because she doesn't have a foul mouth. This is how you can reach out to Comedian Joy. She has a wonderful Eat, Drink, and Ride tour that she does. She does a civil rights tour. She does travel. She does so many things. My daughter did her Sweet 16 with Comedian Joy on the bus. She had a ball. Even though it was just a few of them, they had a really good time, and Comedian Joy helped us plan a wonderful, memorable Sweet 16. Don't forget about her for your proms. The proms will be coming up. Homecomings, if you want your children safely taken somewhere where you don't necessarily have to be with them the whole time, depending on their age. Comedian Joy is a great resource for all of your party needs for adults and your teenagers.
Yeah, because I found a video in my memory. I think Marley had just turned 13. I was like,
yes.
Oh my God.
Yep, she did about her 13th and her 16th. So when we're doing it big, we do Eat, Drink, and Ride with Comedian Joy. Next year is my 50th birthday, so it's going to be all about me. So I'll probably be doing me a little party at some point in 2025 for my 50th year of life on the Eat, Drink, and Ride bus as well.
Yes, because of course we have those same Virgo birthdays, and I have tons of memories with you on the bus with your team, you and your family. So it's been a pleasure. And you all make sure you go and get those appointments, because I am going to get my appointment, because now that I know, I need to let her see the other side, because health is wealth, and you have no reason, because you done heard it here. Right. So we look
forward. You don't know what you don't know, but now that you know, we're going to do what we're supposed to do.
Exactly. So we look forward to seeing you all on another weekly wellness with some more good information. So log on to me, MeBellaWellness.com for your appointment, and then for the other services, and then we're going to celebrate it on the party bus.
Right. And follow us on all the social media platforms. I hope y'all have a wonderful Saturday. Tomorrow, don't forget, we have Ageless Intimacy with Dr. Mia and Joseph. I forgot what we're talking about, but we're talking about some good stuff. And it's always got something to do with some intimacy and some wellness. So make sure y'all join. Bring your husbands. I got a lot of patients who are like, I'm feeling so much better with my pellets, but it's hard for me to talk to my husband about it. Let him join us for the Ageless Intimacy with Dr. Mia and Joseph, and then they get to hear from our male intimacy coach from a male perspective, as well as us talking about the women's wellness too.
Exactly. So we hope you have a great weekend. Make those appointments, and we'll see you on the next edition of Weekly Wellness.
Weekly Wellness with Dr. Mia. See y'all later. Go live well, age well, and experience
everlasting intimacy until you die.
Until you die. Bye.